Assalamu alaikum wa rahmatullahi wa barakatuhu, sister. How are you? Hope you're doing well. My name is Muhammad Yasir. You are my old customer. Hope you know me very well. I'm a physiotherapist since 14 years and I have a very good knowledge about this all kind of condition related to the orthopedics. So I just want to tell you first thing, which is very important for your information, that of course I'm not against any of orthopedic surgeon or any of medical field staff or any consultants. Of course, the orthopedic surgeon, they are more qualified, they are more expert, they have a more good knowledge. But due to some of the doctors in my career, I seen some that sometimes it's not required the surgery, but they are still recommending the surgery. So that is the reason I'm going to make the video to you, and I need to explain you something. I'm going to share my experience with you. It might be helpful for you for the future, because why I will consider the doctor more, one reason that I did not see your child, I don't know about his knee condition, I did not see his x-ray or his MRI, so we cannot say anything, because there is a 3 level of the injuries. It comes in the ligaments: grade 1, grade 2, grade 3. If in case, for God bid, it's for both, like if you say it's the 3rd level injury, which is severe injury, it means the ligament is completely displaced. Okay, so for sure this is the only option for the surgery. But if in case it's a grade 1 or grade 2, it's not fully broken, it's only the tear, so it's not required a surgery. It can be healed by the physiotherapy. For the some formula, it's called RICE, rest, ice, I for ice, and for compression and elevation, and some support, and some physiotherapy, so it can be healed quicker. Okay, so the first thing to find out, that if you know that if the knee is not completely the ligament is not completely tear, so the test for this one that we have to check, because sometimes the people have severe pain, so that time the examination is very difficult, some tests. So for sure, when the pain is come less or the swelling is come less, so in this case they can check your knee to find out that if it's completely displaced or no. So the test of the ligament, the ACL is the main ligament, is in the knee, as you know, which is I will show you on this part, that it's showing, it's the main ligament which is attached our both bones, like the thigh bone and the lower leg bone. So this is upper bone, this is down bone. So there is a 4 ligaments are here. This is patella, actually, patella tendon, patella cap. So behind that there is a meniscus. This is the LCL, which is outside of the knee. This is MCL inside, and between that there is one ligament which is attaching 2 bones, leg bone and the thigh bone. Is called the ACL, anterior cruciate ligaments, which is the most strongest ligament, which is especially in connecting the 2 big bones, the thigh bone and the down bone, leg bone. Okay, so it's backside, it's here actually, the PCL, sorry, the ACL, sorry, anterior cruciate ligaments. So what I was trying to explain you, madam, that see, there is this ligaments what I show you are inside, LCL, MCL, ACL and the PCL. So what's happening when the ACL is completely torn or is completely displaced? So the knee is not stable, like the knee is going move forward. Like this is my knee, for example, it's going move forward, because all other ligaments are safe and this is can go move forward. The knee is not stable like this. You will feel that if it's completely tear, it's completely in the 3rd grade injury, it's completely displaced, so the knee will go move forward like this. Knee will not gonna stable, like when you are walking, there is no stability are left in your knee. The knee is coming move forward. The knee is not stable, like the knee is going move forward. Okay, so what we do in this case, especially for some of the players, okay, what I was trying to explain to you about the brace, this is called first ligament knee brace. It's a functional brace. As I mentioned, there is a 4 ligaments. Okay, 1, 2, PCL 3 and 4. So this is also the brace what I was talking about. This is fully metal brace. See, the metal are front, the metal are at the back, also on the side. So this brace you have to wear like a socks, which is come from the down, and you can consider as the ligament, external ligaments. How? Because these 2 parts, you can see this is the metals, this and this. When you will wear it, okay, this metal part, it will not allow to go the knee move forward. Like the pressure will be automatically less when you have the ACL injury. This is ACL functional brace, so it will not allow to go knee move forward like this. And this is the PCL part, which is called at the back. So when you will wear, there is no chance to knee go move forward or go move backward, because why? This is blocked. You see front, okay, front, back, and both side of the knee. So my knee will go, for example, like this, okay. So this is external ligaments, okay. So it can work flexion extension, okay. For example, if I'm using as a PCL, this is my ACL, this is my PCL. So see, if I want to start to move, my knee will be freely go control, but it's stable inside. For example, this is the knee, okay. This is the knee, and I will put, for example, from upside like this way, okay. Okay, I put it now. So see, this has four supports for the ligaments. This will work for the PCL, so knee will not come move forward. Number one, okay. When you have especially the ACL, it will not come move forward, okay. And then exactly there is a back support for the PCL, so knee will be stable. It will not go move forward, not go back forward. It will keep stable. Also, the left, the outside, it's called lateral side, and the inside, which is called medial, MCL. So LCL and MCL also stable. This with this. So this is the brace when you will wear. We consider this brace as a ligament brace. So it keeps the knee very stable. You can walk like this, for example. There is no any restrictions. You can like just bend your knee freely like this, okay. But around my knee, there's a full ligament metal are here. See, front, back, so you can freely move your knee like this way. But this external support, PCL, ACL, MCL, LCL, will keep hold and keep your knee stable, so it will not go move forward. So this case, this brace is very helpful for the recovery instead of the normal braces, which has only the metal on the side, left and right. So they can give you stability from the rotation, but the front and back, as I mentioned, this part and this part, they don't have. So knee can move front and it can go backward. So this is the brace as I was talking about, which is very safe and stable. Thank you so much.